Good day everyone. I'm Robert, the moderator for this webinar. I welcome everyone for today's webinar, CMS Preventive Services Medicare Patients. I would now like to introduce our presenter for today, Jan Rasmussen. Jan Rasmussen, PCS, ACS, OB, ACSGI. As a healthcare consultant, Jan has over 45 years of experience in physician billing, reimbursement, and compliance. Jan is currently the owner of Professional Coding Solutions. She has been a certified professional coder CPC since 1992. Jan has been a speaker at the AAPC annual conference. In 1994, she was honored by AAPC as Networker of the Year. I would now like to hand over the floor to the speaker. Over to you, Jan.
Thank you. Welcome, everyone. We're going to talk about preventive services. And yes, we're focusing on Medicare's because they're the ones that really define preventive services, what they will or will not cover. But I need everybody to remember that not all Medicare patients are 65 or older. We do have some disabled and younger patients that are Medicare. So keep that in mind as we're going through some of these guidelines. Okay. First, we're going to talk about the preventive office visits, 99381 through 99397, new and established patients. It includes counseling, anticipatory guidance, risk factor reduction interventions. It does not include any immunizations, ancillary studies, lab or x-ray. Requires an age risk-appropriate comprehensive history and exam. The diagnosis codes that go along with annual physicals, HMEs, Z00.00 and Z00.01. You can have a prevent and a covered visit on the same day. Medicare preventive services. We've got our breast and pelvic exam, which is a GO 101, and it's payable every 2 years for Medicare patients. GO 101 is basically reimbursement is less than a 99212. It requires a carve-out when billed with preventive medicine codes 99385879597. Routine for a GO 101 is Z01.411, Z01.419. What is required? To bill a GO 101, you have to have 7 elements. Also, Q0091 is billed separately for collection of a pap smear, and G0091 and GO101 may not always coincide for frequency, and they may have had Q0091 in 2002, but in 2003 they had a GO101. So watch that carefully and make sure they're eligible for the service. Now, the key here is, which I find very interesting this year, a little tidbit on upcoming changes to CPT. CPT added 99459 pelvic examination, lists separately in addition to code for primary procedure. Male preventive services, GO 102, and blood test GO 103. The diagnosis would be Z12.5, screening for encounter for malignant neoplasm of prostate. Now, you have to be aware that there are some separate S codes out there. They're not payable by Medicare, but some of the blues will accept these codes. You need to PAP pelvic on some of the issues. You need to know what payers will accept G codes or Q code. And some payers want the S codes instead of a GO 101. Other payers may want preventive medicine with a modifier 52. According to the AMA, that's not acceptable. Well versus sick visit. How do you separate the sick level of service? Where are our risk areas? Never reporting preventive med services. Another one is reporting preoperative services as routine physicals. They should be reported with office visit codes. So now we're going to talk about Medicare preventive services, IPPE and annual wellness visit. IPP, I hate the term. It's called Initial Preventive Physical Exam. Code for that is GO402, IPPE. The IPPE is not the same as an annual physical. There are separate G codes for screening EKG if performed. Reimbursement is about $166. They can be performed by a physician or non-physician. If you do an IPPE and you also do all the components of an annual physical, I look for, was there a complete review of systems? Was a more extensive exam? Then you can carve out the charge for the IPPE from the 99397. Annual wellness visit is again a preventive wellness visit, not a routine physical. A yearly physical, 99385 through 87, 99395 through 99397, is never a covered service by Medicare. Subsequent wellness visits are covered every 12 months. It can be performed by physicians, physician assistants, nurse practitioners, clinical nurse specialists. Now, a medically necessary E&M visit may also be billed in addition to in that preventive or that sick visit. Remember that with the annual wellness visit, that all components must be met to bill it. Calculating frequency. Well woman exam, GO101 and the Q0091 may also be performed in addition to an annual wellness visit. Prolonged preventive services, GO513 and GO514. Waive deductible and coinsurance. Breast and pelvic exam we've talked about, pap smear procurement, screening mammography, additional CMS covered services. And I think this is where a lot of our primary care groups are missing opportunities to bill. High-intensity behavioral counseling to prevent STIs, GO445. Intensive behavioral therapy for cardiovascular disease, GO446. Intensive behavioral therapy for obesity, GO447. Hepatitis C screening. Behavioral counseling basics. Smoking cessation counseling. 99406 is 3 minutes up to 10 minutes of smoking cessation. It's about $15 reimbursement. 99407 is greater than 10 minutes. The reimbursement is about $28. It's covered for patients who use tobacco, whether they have signs or symptoms of tobacco-related disease. Alcohol misuse. GO442 annual alcohol misuse screening. GO443 is a base face-to-face behavioral counseling for alcohol misuse. Patients with that screen positive will then cover GO443. What is the criteria for misuse alcohol but not alcohol dependent? Then we have depression screening. Annual depression screening, GO444. CMS does not identify specific depression screening tools. Documentation. Sexually transmitted infection prevention. Visit elements. What's high-risk sexually transmitted infection definition? Risk factors, which can be taken into consideration. The diagnosis codes fall into the Z category. Basically, it's a Z70.0, point 1, point 2, point 3, point 8, and point 9. Here's Z72.55. 1 is your high-risk heterosexual behavior, high-risk homosexual behavior, Z72.52, and high-risk bisexual behavior. So we have all these diagnosis codes. GL446 is your cardiovascular disease risk. It's an annual face-to-face intensive behavioral therapy for cardiovascular disease. GL446, cardiovascular risk, counseling for obesity. GL447. Okay, now let's talk about screening terminology. Appropriate screening for preventive services. Now, immunizations, pneumococcal, influenza, COVID, hepatitis B. I hope you will take these back to your doctors and encourage them to document a little better on these things.
Thank you, Jan. That concludes the session for today. Thank you everyone for participating. You may all disconnect now. Have a great day ahead.